Good evening, everyone. And very warm welcome to all of you in this special session, the 11th session of Sudanese Doctor Union of Ireland Academic Marathon for 2025. My name is Ahmed Hameda. I'm the Media Secretary of Sudanese Doctor Union of Ireland, and I'm currently working as a emergency medicine SPR in UHL. It is my absolute pleasure to have an excellent lineup of speakers, and I'm going to be the moderators of today's sessions for this very special Emergency Medicine Day. We have an exceptional lineup of a speaker who will provide us with a comprehensive journey through the landscape of emergency medicine, training, and practice in Ireland. So we will delve into the CSTEM, the core specialty training. After that, we'll go to advanced specialty training in emergency medicine, and also through the alternative pathway to becoming a consultant. Before we start, just a few housekeeping notes. Before we begin, a quick housekeeping notes will be, I would appreciate if everyone could mute his speaker microphone to avoid any disturbance of the session and to make sure that the session moves very smooth. I would kindly encourage also to obtain your CBD points for all the participants. You can complete your registration through the link provided, and we'll keep question and answer to the end of the sessions. First, I would like to introduce very special colleague. Truly honored to begin with by introducing a distinguished colleague and mentor, Dr. Ashraf Abdel Gadir. Dr. Ashraf is a consultant and clinical lead for emergency medicine at Naas General Hospital. Dr. Ashraf has extensive international experience. He is a respected clinical leader and dedicated educator, passionately committed to advancing emergency medicine care and training future clinicians, with the key focuses on education, mentorships, and healthcare leadership. We are absolutely delighted that Dr. Ashraf has joined us today, not just as an attendee, but to help overview and moderate this session with me. Please, Dr. Ashraf, feel free to comment or ask any question to our respective speakers at any point, and your insight usually definitely is invaluable to us.
Thank you.
Then I'm going to introduce my former first speaker. Now let us meet our former first speaker, Dr. Alaa Khalid. Dr. Alaa is currently CSTEM trainee at Tallaght University Hospital. She will be starting us off with a foundational talk, giving us a clear insight into the CSTEM training pathway. Dr. Alaa, the virtual stage is yours.
Hello, everyone. Good evening. My name is Alaa Khalid. I'm currently a year 1 CSTEM trainee in Tallaght Hospital, as Ahmed informed you guys. I'll be starting the session today with a brief talk about the CSTEM, the core specialty training in emergency medicine in Ireland. The first thing we need to know is that the core training in Ireland consists of 3 years. The structure of this, it's under the RCSI, the Royal College of Surgeons Ireland, and it's based on the Royal College of Emergency Medicine, the RCEM curriculum. The structure of this training is that you have to do 18 months of emergency medicine, 6 months of acute medicine or orthopedics, plastic surgery. That differs from a hospital to a hospital. Also, you'll have to do 6 months of pediatric medicine and 6 months of anesthetics. That's just an overview of the whole thing. So it's a total of 3 years divided this way: 18 months of pure emergency medicine, 6 months of acute medicine, orthopedics or plastic surgery, 6 months of pediatrics, and 6 months of anesthetics. there are certain things that you have to be doing. Sorry, I'll have to press slideshow, I think. There. I think it's better now. So during those three years, few things have to be completed successfully so you can proceed to the next level, which is the advanced specialty training, ASTEM. Those things include workshops, different kind of workshops. We have ECG workshops, we have airway workshops, simulation workshops, many of them. We have human factors courses, which includes patient safety, communication with patients, communication with co-patients and patients' families, which is a day-to-day thing that happens every day. You also have to be signed off from ultrasound courses. There is a basic ultrasound course, which you do during your training, and then you'll have your logbook, which has certain things that has to be ticked off. There's number of each type of imaging that has to be fulfilled in order for you to be signed off. And in, I think, year 2 or year 3, whenever you're ready, actually, you can submit your logbook to be signed off. Those images would include IV access insertion, echo, fast scans, so many things we can go through later on if we want. We also have to finish the MRChem membership exams, which is the primary exam, MRChem SBA, and the MRChem OSCE. They have to be successfully passed in order to proceed to ASTEM. And of course, we have to have completed the life support courses, the ATLS, ACLS, and APLS, in order to be able to proceed. Now, about the timing of doing those courses, the itinerary gives you certain, so the workshops, you'll have to do certain workshops in each year. But and that includes the human factors courses as well. But for the MRChem membership exams and the life support courses, you can have them whenever you're ready. And that includes the ultrasound sign-off as well. How do they assess your progression and assessment? So there is 2 formal appraisal sessions every year, the CAPA, which is done, I think one is done in June and one is done in January. They give you certain times every year. And in those appraisals, you will get your consultants to fill a form, I guess, and you'll go to the RCSI, and they will basically have a discussion about what you've done and what you need to do. It's literally an assessment every 6 months. In year 1 and year 2 of the CSTEM, you will have to have an OSCE by the end of each year. And that OSCE is mainly for your human factor courses. They get you to practice what you've learned in those courses. And the last form of assessment is the assessment of suitability to progress to ASTEM. And that's some sort of an interview that is done in year 3. Based on what you do there, they, I think, assess and to see if you're ready to proceed and if you've completed the requirements to proceed to the next level of training. Now, so we're going to start talking about how to apply for CSTEM or how to get to CSTEM. First thing is the CSTEM application, which starts in October of each year. I think this year it will start at the 24th, but you can find that on the RCSI website. And it's an online application, and it costs 50 euros paid online. There are certain requirements that needs to be fulfilled in able to be or to be eligible to apply for a CSTEM. First, you have to, as we said, to submit a full application, full online application completed, providing all supporting documents, and you should have 2 referees listed. They usually send them forms, and those forms are returned online from your consultant or whoever you list as a referee. Second of all, you have to have completed your internship here, so you can't apply before finishing your internship. You have to provide that you are registered in the Irish Medical Council, and you have to have a valid English test, either IELTS or OET. Now, if you've been working in Ireland for over 3 years, you are exempted from having to submit a valid English test. You just provide a document that tells that you're working here for that duration, and you won't have to be asked for this. No. Now, how do we support our application? So it's a very simple online application. You provide all your document, your CV, and everyone can do that. But what makes you special? How do you support your application in order to improve your success rate? From our background in Sudan, we're not very familiar with audits. People are more into the clinical part, but here in Ireland, it's a major aspect, and they value that very much. And this is one of the things I've learned over the years, that audits, research, and publications are very important as clinical experience. So the more you have of that, the more strong your application is. We also have to, we also have to value presentations, any kind of presentation, either in your hospital, in a conference, a poster, verbal presentation. All of them are valued, national or international. And of course, your emergency medicine experience and background. That also includes if you have a background of critical care, anesthetics, orthopedics, trauma. That's all valuable things, and you have to mention them. The CSTEM interviews are, to be honest, very stressful. They're face-to-face interviews, but they're not stressful because they're difficult. They're as any other interview you can go through. But people go there preoccupied by the fact that there are certain limitations. We're going to speak about them later on. But first of all, let's speak about the interview itself. It's a face-to-face presentation or interview, that takes place in RCSI buildings in Dublin. During COVID years, they used to be online, but now they've been face-to-face for the past 3 years. Duration of the interview is 30 minutes. 10 minutes for each station. So we have total of 3 stations. One of them is approach to a clinical problem. Second one is knowledge and dedication to emergency medicine. And the third one is suitability for career in emergency medicine. We'll be talking about each of them. So what can lower your chances, or what are the limitations that can lower your chances in getting a position? First of all, the ranking of the candidates. As an international graduate, we are ranked a little bit lower. So the priority is for EU graduates, doctors who graduated from any EU country, or actually from Ireland first, and then from any EU country. And then we have stamp 4 holders, and then we have people who don't have stamp 4. So if you're a doctor applying and you've recently arrived to Ireland, you're going to be ranked at the bottom. But there are other things we spoke about that can improve support your application. Again, not having a stamp 4 at the time of application could hold you back. Some people would get after the interview and they would send it. That wouldn't make any difference. Lack of interview skills is a major aspect that people have to focus on, because the way you present yourself, basically you trying to sell yourself to the interviewers. There are so many people. The last year they had to interview over 300 people, and the positions limited to 30 slots per year. So people get really stressed, and sometimes they forget to focus on the points that could get them in, although they could have a great experience in emergency medicine, but still they lack interview skills. And also the stress during the interview, as I said, it's a stressful situation, knowing that you're competing for a very limited seats. That would get you stressed. How to tackle this? This is by working on your CV. As we mentioned earlier, you have to work on your audits, research. You have to work on your publications, in presentations, anything, clinical or non-clinical, can support your CV and increase your chances. Also work on your interview skills. And there are some hospitals do mock interviews with their doctors. So that's very helpful. And I find mock interviews with your colleagues who have experience, like your colleagues who made it and got to the CSTEM, are usually very helpful. You can grab some information from them that nobody else would know, because they've been there, they've done it, and they passed. So they have their tricks that could help you. Most importantly, don't give up. It's, as I said, it's very stressful, but it's not impossible. Seats are limited, but not impossible. Keep trying. I personally applied 4 times before getting into CSTEM, so there's nothing impossible. I learned from what was missing every time. The good thing is that the DINRI sent you your results of the interview, and with breakdown of how much you scored in each station. And every time I received that, I worked on what was missing. And I found it helpful, and I worked on my weak points and improved them. Now let's go back to the interview part. The first part we're going to talk about is approach to a clinical problem station. It's usually a very common clinical scenario, and it's usually asked to assess your clinical knowledge, and they want to know that you're a safe doctor rather than a knowledgeable doctor. Both are important, but a safe doctor is crucial in this part of medicine. The adrenaline rush can sometimes let people do things that are a bit unsafe. You have to ensure that you're answering systematically. People with experienced people in emergency medicine would answer like that. They would give them an ECG, they would look at the ECG, and they would tell them, this is that, and this is not what they want. They would go out of the interview saying, I nailed it. I diagnosed the problem and I gave the solutions. But this is not what the examiner was looking for. The examiner wants you to take them over this, let's say, ECG, step by step, how to read it from scratch. They want to know that you are going to speak to your seniors, that you're not going to take decisions, life-saving decisions alone. After all, you're a trainee, and you have to be supervised on taking those decisions. And also, before you go to the interview, make sure that you're following the most up-to-date guidelines, NICE guidelines. They don't expect you to know them by heart, but some of them are ABCs in our career. Knowledge and dedication to emergency medicine is the second part of the interview. In that station, they ask you all those listed questions. Not all of them. They sometimes ask you 2 or 3 of them. But the first question they ask you after you introduce yourself is, take us through your CV. And this is where most people lose points. You forget to, with all the stress, you forget to mention so many important things that you've done, and they could be important. without you knowing. They can ask you, why did you choose emergency medicine? They can ask you, what do you like about emergency medicine? What do you know about the emergency medicine training in Ireland? So if you get listed for an interview, you can go over and watch this recording again, knowing what type of training are you going through, different levels of training. That's very helpful. They would ask you about your audits and research, and if you have any presentations, any publications. They will ask you about courses, life support courses, and if you've taken any exams. And they will also ask if you have any future plan. They would ask you if you were successful and you finished your training, what's your plan? So you have to be ready, and you have to have answers for all those questions. And the last part of the interview would be the suitability for career in emergency medicine. In this station, you're asked about the problems facing emergency medicine in Ireland. There are very common problems, everyone knows, which are, let's say, overcrowding, lack of staffing, so many problems facing emergency medicine in Ireland. They will ask you, what do you think solutions are? There's a very common question about, what do you think your points of weaknesses are, and how are you working on them to improve them? They will also ask you, what are your points of strength, and how does that help you in your career? Another common question is, they would ask you to call a difficult situation that you faced while working in your emergency medicine career, and how did you act? How did that affect you? What did you learn from that? Those are all very common questions. Now, I can't say there's a right or wrong answer, and one of the big mistakes is that people go into the interview with a pre-ready answer in their heads. And if the questions were changed, they would freak out and they would panic. Now, everyone have different experience. Just be yourself, be honest. Think about all those questions, all of them, and be prepared for all of them, not one or two. And I'm sure you'll find your answer. I think that's me, Ahmed. I think we will leave questions for later on.
Okay. Thank you so much, Ara, for this excellent and very clear overview about CSTEM program. And I think that will really sets up a perfect foundation for the next talk, which will
If you
be.
don't mind, I might just comment quickly, if that's okay.
Yes. Go ahead.
Thank you very much, Alaa, for this very, very comprehensive and really very knowledgeable and very informative talk. I suppose the one thing that I wanted to talk about briefly is how important it is that people very early on in their careers understand the importance of having robust interview skills. Interviews are a part of your career progression, no matter what specialty you're going to be in. You're going to have interviews done for you at the core training level, the advanced training level. It will determine your consultant post. It will determine if you're looking for any postgraduate. Anything at all that you're going to do is going to depend on your interview skills. In terms of building those skills, it's very important that you start early, like I said. You have to have general knowledge of basic interview skills. These can be attained through numerous resources online. There's specialized courses that I think are very, very helpful for people. A lot of courses, particularly geared at medical specialties in general and in emergency medicine. In terms of preparing for your CSTEM interviews, I think the three important aspects, and I think you've mentioned Most of them, Alaa, are the knowledge of what the interview is going to focus on, which you went through very, very comprehensively. Then it would be very helpful if you can attach yourself to a mentor, preferably a consultant in your department who is somebody who actually does the interviews, is part of the CSTEM interview panels. They have intimate knowledge into what is being looked for, and people are very helpful. Generally, in emergency medicine, consultants all over the country would be more than happy to support. As well as that, there are specialized courses, like I said, particularly over in the UK, that do courses geared at basic training in emergency medicine, the core STEM, so ST 1, 2, 3 in the UK, and CSTEM over in Ireland. And then the third one, which you mentioned, is actually talking to people who have gone through the interview process before. And it's always very helpful to kind of have a buddy relationship, and I'll comment about having a buddy colleague, usually preferably either somebody at your own level or somebody who's just a little bit more senior to you, to kind of bounce training, interviews, exams, studying, everything off one another. Okay, it's always very, very helpful to have that sort of a prop or that sort of support in your career. Thank you.
Okay, thank you so much, Dr. Ashraf. So I think we'll move to the next. Building directly on that foundation of the CSTEM, we now move to the next stage of the training ladder. I'm pleased here to introduce my friend and my colleague, Dr. Ammar Yasir. Dr. Ammar completed his 3 years of CSTEM at University Hospital Limrieck, and he's currently an SPR at Cork University Hospital. Dr. Ammar, the microphone is yours. Can I share your screen? Ammar, unmute yourself and you can share the screen then. Thank you.
Perfect. So good evening, everyone. And first of all, thank you for giving me this precious opportunity and inviting me to present this topic today. I'm Ammar Yasir. I'm one of the first-year ASTEM trainees in Cork University Hospital. Now, the objectives of my presentation today are going to be to focus on, first of all, the application. Second is the interview. Third is an overview of the ASTEM program. And the fourth part is going to be a quick tips and tricks. Before starting, as my colleague, Dr. Alaa, mentioned, the emergency medicine training in Ireland is basically sponsored by the RCSI, and it is conducted under the supervision of the Irish Committee of Emergency Medicine Training in association with the IAEM, and they are following the ARCEM guidelines and curriculum. Just to break the ice a little bit, I totally understand that there are loads of concerns about the number of seats, how people can progress. That's why I wanted to highlight those recently published documents. The first one is the emergency medicine training intake data, and the second is the emergency medicine workforce in Ireland from 2024 to 2038. So this document clearly stated the percentage of applicants who applied in 2018, what their nationalities, and how many of them proceeded to the ASTEM training. We can clearly see that in 2018, 100% of the applicants were of an EU national. Only 30% progressed into the ASTEM training, while in 2024, 40% of the applicants were of a non-EU, which is a very great news for us, and 81% progressed into the ASTEM training program. The second document, which is the emergency medicine workforce in Ireland. This shows what is the plan for the HSE and NDPT to the recruitment of the emergency medicine trainees. So in 2024, the total of CSTEM trainees was 30, and they are planning to increase that into 40 by the end of 2038. On the other hand, the current number of ASTEM intakes is 16, and that's supposed to jump into 30. So that's approximately 100% increase in the number of the ASTEM trainees. Now, going back to the objectives, I will start by the application. So the application is usually, the applications are usually opened on October. Actually, this year it's going to open on the 15th of October. It lasts for a month, so it ends on the 14th of November. The applications focuses on 6 different perspectives. The first is the clinical experience, relevant courses, what qualifications the candidate have, what presentations are done, if they do have any publications, and last is if they have any audits. I'm going to speak about each of these. So clinical experience, it's a very detailed document. It shows that you need a minimum of 18 months on emergency medicine. And if you work as a reg, that gives you a half a mark bonus. You must work in pediatric department or PEM, and you should have a critical care or anesthesia background as well. Beside that, people or candidates who have any background in medicine, surgery, psychiatry, they all marked between 0.25 up to 1.5, depending on the list that's attached. Second is the relevant courses. Now, I totally understand that most of the doctors are all eager to apply, and they spend a vigorous and a huge amount of money for courses, but unfortunately, not all those courses count. So it gives, you have a maximum of 5 marks. Courses that count are the MIMMS, which is Management of Incidents Planning, Hospital Management Planning, Level 1 and Level 2 Ultrasound, European Trauma Course, the ATAC, FUSIC, and the procedure courses. So courses that don't count are basic surgical skills, any exam preparations, courses related to research methodology. Beside those courses, we can count the EGLS, the Echo Guided Life Support, can be counted, and neonatal life support is counted. Certain radiology courses, one of the famous websites is Red Dot. Those courses are all counted as relevant courses. Third are qualifications. Any qualification that is related to emergency medicine is counted, starting from PhD to diplomas, any postgraduate, any postgraduate certificates. They are all counts, and the candidate can have a maximum of 10 marks. Publications, and depends on, are you the first author, second author, or third author? And this is the full list of how many marks, but keep in mind that the maximum is 10 marks. Now, The last two are audits and presentations. We'll speak about presentations. It's 8 marks maximum. If you have an international oral presentation, that's a 2 mark. If it's a national oral, that's 1 mark. Is it a poster? Regardless, is it international or national, that's half a mark. When it comes to audits as well, it's 8 marks maximum. If 2 marks per each full audit. So to be clear, to be competitive, you need a minimum of 4 completed audits. If you have a single cycle of an audit, that's a 1 mark. And the only way for those marks to be submitted and counted, that audits should be presented as an audit report stamped and signed by the supervising consultant. A personal advice, it will be much appreciated that you submit at least 2 completed audits with multiple other single audits, because that shows that you are keen to complete a project rather than submitting 7 single cycles audits, because the panel will say, okay, this candidate had 3 years. Instead of finishing a project, he was scattered, not focused, and he did 7 unfinished projects, and that's not ideal. Now, I will move to the interview. So the interview is usually after you hear a very good news that you have been shortlisted. Interviews are in March, approximately the 2nd to the 3rd week of March. The interview is composed of 8 different stations. Each is of 15 minutes. The candidate will have 2 rest stations, and each station is of 20 marks. So the most common 10 subjects are, first of all, the first station is your CV and suitability for emergency medicine. Here comes your experience, a discussion about your vision, what are your plans, and how you're planning to stand out. Second station is academics in emergency medicine. So the panel will have all your academic work from audits, QIPs. I would personally advise that you have a hard copy of each, so you can present it at the day of the interview. Don't bring to the table stuff that you forget about. So if you're presenting something, some of the consultants may be interested and they may ask you a certain question. So if you're unsure about any data, don't put it on your final report, okay? The third is complaint handling. You will be provided with a scenario of a complaint. How are you going to handle that? And there is a very clear HSE guideline regarding this station. Fourth station is education in emergency medicine. What are your experience in education? Are you participating in any teaching regarding SHOs, medical students, etc.? Difficult clinical scenario. When we say difficult, it's not about difficulty in management. It can be in management, in communications, where ethical difficulties, and how you weigh the risks. So it's just imagine that you are on shift. Imagine that this patient is in front of you and deal with them the same way. Next is risk management in emergency medicine. A small scenario with error as well. There is an HSE guideline and policy that will facilitate you. So all the candidates should be aware of that policy. Challenges in the emergency medicine, as my colleague Dr. Alaa mentioned, there are a bunch of common issues that the HSE basically facing, from crowding to workforce planning to incivility, etc. There are, like, the answers are known, but you need to be unique. Keep in mind that everyone knows what are the problems, but the way you address it is how you're going to stand out between your colleagues. Workforce planning, communication and civility, knowledge of emergency medicine. So in the last couple of years, the last 3 sessions have been changing. Initially, it was workforce planning. Then there was a jump into knowledge of emergency medicine, where the panel gave you a test, a quiz, asking who's the president of the RCAM, who's the president of the IAM. So it's like a general knowledge about the emergency medicine in Ireland and in the world. But in the last 2 years, this have been changed into communication and incivility. Basically, how to communicate well with colleagues, with relatives, and with other specialties. And as I mentioned, every station is for 15 minutes, and you're marked with a maximum of 20 marks each. Third is an overview of the training program. So the ASTEM training program runs through 4 years. There is a trend that 2 of them should be in Dublin, 2 of them should be outside Dublin, but the fixed rule are that you should definitely have certain clinical rotations, 42 months in emergency medicine, 6 months totally focusing on PEM, and definitely you should have 6 months on a trauma center. By that, it's either Mater Hospital in Dublin or CUH. Exams-wise, you should complete the fellowship exams of the Royal College of Emergency Medicine, which are the SBA and the OSCE. Definitely, there should be a certain focus on quality improvement. So all candidates are pushed and encouraged to submit a QIP. It will be better to submit that by the 3rd year, because you can go multiple times for revision. So keep a chance for yourself for the last year in case they ask for some amendments. All candidates should have their life support courses up to date, which are advanced cardiac life support, advanced trauma life support, and advanced pediatric life support. Ultrasound, as mentioned by my colleague, Dr. Alaa, you CSTEM trainees will complete an introductory course, but you should have your logbook completed and you should have an official sign-off. All candidates should submit a clinical guideline, and that should be submitted to and published to the IAEM. So this is requirements to have your CST. Beside that, we have certain RCSI workshops, from human factors workshop and simulation days. On the other hand, all the ASTEM trainees do have a monthly SPR teaching day that are usually divided among the different hospital groups. They do have their annual winter meeting that takes place in winter in Limrieck of each year. It's a 2 days meeting where the trainees express all their issues to the Irish Committee of Emergency Medicine Training and have dedicated sessions as well. Beside that, you will have the RITA. The RITA is the record of in-training assessment. So it's a one-to-one evaluation at the end of each 6 months. My fourth and last is going to be some tips. So preparation is the key. In my situation, it took me 3 months to prepare for this interview. I'm totally aware that plenty of you have heard all advice about how to present, how to be presentable at the day, how to work on your vocabulary. But from my perspective, I'm going to focus on 5 different aspects. First of all, you need to find a selling point. So you need to figure out what would you be best at. Those consultants on the panel knows that you're all qualified, but why would they choose you? Are you interested in teaching? Do you like simulation? Are you someone who have an avant-garde vision about any kind of political interventions? Would you like to focus on training, on research? Figure that out, highlight it, and reflect it on your applications. Second, that you need to start networking and connections early enough. Sit with your consultants, sit with colleagues from other hospitals, attend the annual meetings. The IAM is taking place next week on Thursday and Friday. Show up, communicate with your colleagues, with other consultants, and show that you're enthusiastic about this job. Even if you're planning to sit from not through the CSTEM training, figure out a hospital where the consultants have an input on the panel. Definitely should you make yourself familiar about the most common policies and guidelines and practices, and what are the hot topics at this year. Like 2018, it was the cyber attack. After that, it was COVID, and after that, it was the overcrowding crisis. Now people are talking about AI and green emergency medicine. So keep those topics in your mind, read about them a little bit, and that will help you develop the lingo, the language that they will love to hear you talking about in the interview. No doubt that interview coaching is a must. If I'm advising anyone to invest in anything, it is to have interview coaching. Beside that, you should definitely read this book not less than 3 times from the first to the last page, because it will give you a comprehensive guideline about how to proceed in the interview. Last is practice. Record yourself, ask your colleagues to do a mock examination for you. You will be surprised how you can stutter if you're not prepared. Remember, you have 20 minutes, you have 15 minutes in each station. Don't waste any minute repeating yourself. Every second counts. If you didn't do that, there will be a candidate who is prepared. That's it, and I'm happy to take any questions, but I assume that's going to be at the end of the session. Thank you so much for your attention.
Thank you so much, Ammar, for shedding light on that progression to ASTEM and give us an excellent overview about the program itself. Dr. Ashraf, do you have any comments?
Yeah, thank you very
Before
much, Dr. Ammar. That was, was very well prepared, very well done presentation on the ASTEM. I suppose what I would like to stress, I wouldn't add anything really to what you've said. You've really covered it very well. But I would like to stress that Ireland in particular is a small country. Okay, so networking is of the utmost importance. I can't stress how important it is. Like you were saying, I think membership of the IAEM, membership of the ICMT are a must for everyone that's working in emergency medicine and is hoping for a career in the specialty. You have to be a member of both societies. People who are on PAYE posts, HSE posts will be getting payment. They can get the money back through the TSS. It's a really, really, really sound investment and totally worth it. Being present at their conferences, the annual scientific meetings, the annual general meetings, whatever, you have to put your face out there. They have to see you. They have to know who you are, so that when you come for the interview, you're a familiar face. That really goes a long way. Other than that, again, I would thank you, Dr. Ammar. I think that was very brilliantly presented. Thank you.
Thank you so much.
Thank you, both of you. Our journey continues, but now onto a less conventional path. I'm very thrilled I'm delighted to introduce my friend and my colleague, Dr. Farhan Zafar, Farhan is currently an ASTEM trainee, an SPR in University Hospital of Limrieck. But his route into the program was unique. He's one of the few who successfully navigated the side entry to the ASTEM by completing a CSTEM equivalent. Dr. Farhan, we would love to hear about your experience. Let's go ahead and share your slides.
Thank you very much, Ahmed, for invitation, and good to see few familiar faces after a long time.
Ambos nights, yeah.
Yeah, post
Thank you
nights
for
as well.
attending.
Yeah, thanks. So Alaa and Ammar have comprehensively covered most of things CSTEM, ASTEM, and so I would be just specifically talking about side entry into ASTEM and my journey to higher training in emergency medicine. There are like few things that we will be talking about. What is side entry, eligibility and application process, and how scoring and selection work, and my experience and tips. Most of things are covered by Ammar, but we will just briefly talk about them as well. So ASTEM is 4-year specialist training program. And at the end of that 4-year, when you finish and when you complete all things, you get CCT in emergency medicine. And it's administered by Irish Committee of Emergency Trainee and Royal College of Surgeons in Ireland. And training sites are Model 4 and Model 3 hospitals, including trauma centers and trauma units. So Model 3, only those hospitals they are trauma units, they are part of the ASTEM training. So we will talk about what is side entry. So side entry is actually a route for doctors who have not completed CSTEM, but have equivalent EM experience. So especially a lot of Pakistani and Sudanese doctors who were working here many years, and initially they try for CSTEM and then they have been told that you are overqualified. So this is good for those doctors. They have like good experience, but they are now have been working for a few years, so they can do that and go direct for ASTEM. So there are small number of SPR posts reserved each year. So when I say like small number, so there are just 2 seats. So as Ammar told initially, said last year it was 18 posts. So out of those 18, 16 were for CSTEM and just 2 posts for side entry. And on those 2 posts, all those CSTEMers who never applied for ASTEM for 2 years, they will also come and join you in the competition. So that would be very competitive process. Unless if there are no previous CSTEMer, then they will be just specifically for side entry. And applicant must demonstrate CSTEM equivalence and meet exam requirement that we'll talk in next slide. And there's a competitive shortlisting and interview process, ideal for doctors with several year EM experience in Ireland, UK, and Australia. And then is the eligibility and requirement. So at least you should have 3-year post-internship clinical experience, including 18 months in EM. That EM should be Ireland, UK, South Africa, or Australia. Then 6 months in anesthetics, ICU, or equivalent CSTEM competencies. So it's not necessary that you have to do 6-month anesthesia or ICU rotation. If you are working in good trauma center and they're doing intubation, central lines, and art lines, managing vents, so their consultants can sign up for those 6-month anesthesia rotation. And next 6 months is pediatric emergency medicine or general pediatrics. So these are the 2 6-month rotations you need. And then remaining 6 months would be anything, because as a CSTEM, some hospitals, they are doing orthopedics, some are doing general medicine, some are doing plastic surgery. So these 6 to 12 months that you're remaining, that would be just emergency medicine or general medicine, surgery, or ortho. And then you should have MRChem, all parts passed before closing date. So as compared to when we talk about CSTEM, even if they don't have final OSCE result, MRChem OSCE result, so they can apply for ASTEM, but they should have result before the interview. But for side entry, you should have passed all MRChem. And then you should have mandatory life support courses, including ACLS, ATLS, and APLS, and then Irish Medical Council registration, that if you're working, definitely you will have. Then application and references, like now onward, mostly things are same as CSTEMer. So you should have completed form plus 5 structured references, 1 from current post. So you can see like you need 5 structured references. So it should be like from emergency medicine consultant mostly. And you should have proof of MRChem, 4 certificates, publications, research, and evidence. And then you should have like just feeds. And timeline is, as Ammar said, applications start in October, November. Shortlisting is in January, and interviews are normally in March. So shortlisting, these are few points that were highlighted in previous presentation. So these are the marks that we have to work on. So if someone is interested in going through the side entry, so clinical experience is 15 marks that everyone gets. And relevant courses, a lot of people work very hard on the courses. So you can see just 5 marks for the courses. So if you have done 5 courses, that's enough in last 3 to 5 years. And then it comes to the qualifications. And qualification, Ammar has discussed in detail. If you have PhD, masters, that's very good. So if someone is planning in few years to apply for ASTEM, they should start master. That should be 1 or 2 year master. And they can get almost 5 marks out of these 10. And publications, that has been already discussed, and then presentations and audits. So first, like 2 things that everyone is trying to work on them. So if we start working early on presentations, audits, publication, or get some qualification, we can gain a lot of marks. And if you are applying from side entry and you have more marks as a side entry as compared to CSTEMers, so they will definitely prefer you. And they will say, because I remember like there was a doctor a few years ago who applied from CSTEM, now he's consultant in Dublin from side entry, and he was marked highest in the interview. even highest than CSTEMs. And then keep evidence of all work and ensure relevance to emergency medicine. Then interview process, multi-station format, 8 station, 20 marks for each. They all have been discussed previously. CV and motivation for EM, academic EM, including audit and research, complaint handling and risk management, difficult clinical scenario, teaching and communication, professionalism, understanding the Irish health system. So next is my experience and tips. So if you are planning for side entry, so mostly people all the time applying for CSTEM. So at the same time, we should prepare ourselves that if we don't get CSTEM, we should have some second option. Because first few years we struggle with STEM 4. And when we get STEM 4, we are already 2 years in emergency medicine. Then we start thinking about CSTEM. And then when we don't get CSTEM, so we should have another option. So this is good alternate that we should work on our own rotation early, like pediatric rotation and anesthesia and ICU. Then keep documentation of audits you do and involve in research, teaching, get strong and specific references. So the more important thing in side entry is you have to prove yourself that you are very dedicated, you're passionate about emergency medicine. So the consultant who you're working with, they know like about your reputation and consistent hard work. And they are key to success because as a CSTEM, you have to go through those 3 years. And if you have all tick boxes, you're automatically going to the ASTEM. But if you are trying for side entry, so you have to prove that you are better and actively involve in the department activities and strengthen your application and take on leadership roles. If they ask you for any role in teaching, simulation, ultrasound, so you should be very happy. And if you're working as an SHO and if they ask you for edge role, you should take responsibility because that will be positive impact and that will show your commitment and network with current trainees for insight. And key takeaways are start early, plan rotations to meet eligibility, keep certificates and references evidence organized, engage in audit research and teaching, attend EM relevant courses, including human factors and ultrasound, and seek mentorship. So, and prepare thoroughly for interview. And I'm happy to help like anyone who wants to apply for side entry. You can get my detail from Ahmed and I can share further links or the documents as well for that. That's all from my side. Thank you very much.
Thank you so much, Dr. Farhan, for sharing this fantastic and inspiring perspective. Dr. Ashraf, do you have any comments?
Yeah, just a quick comment. Dr. Farhan, of course, is made a very good presentation as well. And he's living proof that it's side entry is actually something that is achievable. It's very important. Most people think that that's something that's very difficult to achieve, but it is actually he's done it. What I would add is I would build on what he said, and I would add that it's important, like he said, to have you have to have a champion who's knows you and who is pushing for you to be placed in a very competitive position. So in your local department, somebody who's influential, who will champion your cause. Something that is to be said as well for people who are at a senior kind of level and are looking for side entry is that leadership roles are very, very important. And it's something that people shy away from because we don't know how to perform as leaders. Emergency medicine is unlike other specialties in that leadership and management, policy writing, those things are very, very important in the specialty. So if you're looking for or being given a chance or an opportunity to be involved in any leadership roles. Doesn't matter if it's the rota lead, if it's the lead for sepsis in your department, if it's and you can actually come and suggest projects. Say, I'm going to introduce this. I'd like to be the lead for whatever, pneumothorax management or procedures in the department, or it's actually something that you can it's a role that you can create. It doesn't have to be something that's already there. So even if you're in a big department where there's a lot of trainees, most of the conventional leadership roles have been taken up. My advice is innovate, come up with something that you think you have an idea in, and just go to your clinical lead or educational lead or whoever it might be and suggest that you'd like to create this role and you think there is an opportunity to improve the service by doing that. Okay, thank you.
Thank you, Dr. Ashraf. Yeah, I definitely agree with that. Leadership, I think it's not something that you can learn from a book. You have to put it into the practice to nail it. So we'll move on to our final presentation for tonight, for this evening. It is my great honor to introduce a truly dedicated and accomplished colleague, Dr. Aniqa Bano. Dr. Aniqa is a consultant in emergency medicine in University Hospital in Kerry University Hospital. She's a member of Irish Association of Emergency Medicine, clinical guideline committees. She has a special interest in critical care and ultrasound. What makes her journey particularly inspiring is that she recently achieved her consultant registration through the alternative pathway, and she achieved all that while being a mother to three wonderful children. Her stories, I think her story is definitely a testament to a dedication and resilience. Dr. Aniqa, without any further ado, the screen is yours. And I think you have a technical fault with your laptop, so I would be happy to share the screen and to help you with the presentation and move your slide. Is that okay?
Yes, thank you very much, Dr. Ahmed, and Assalamu alaikum, everyone. I am very grateful to Dr. Ahmed to provide me with this opportunity. And as Dr. Ahmed has already introduced me, my name is Aniqa Bano, and I have started in my current role as permanent consultant in emergency medicine at University Hospital, Kerry. This particular topic of career progression, guidance, and achieving your career goals in far away from your own country in a different, non-conventional way is very close to my heart. And I would like to introduce a little bit of my own story, because what have already been said about the conventional training pathways in emergency medicine in Ireland, I don't need to add anything. It was very clear, and I really want to applaud and congratulate all the speakers that have spoken about this process in very great detail. So the only thing that I'm going to add on now is that there is a limit to the resources in the HAC and in the clinical system that we are working in. So not the same opportunities, or you can say the same formula doesn't fit with everyone in their own career journey. So that is the reason that a straightforward entry into the CSTEM and then to the ASTEM and then becoming a consultant, it is not available or practically possible for everyone. But there are alternative pathways which we can consider. Unfortunately, at this current moment, it is not a structured or very much authenticated and approved, you can say, or generalized or generally accepted pathway. So it is still looked a bit down upon or stringent upon, that people are not very much familiar with. And a direct route is what most of the emergency consultants are being formed in Ireland, is through the direct route. But in other specialities, like in anesthetics, that I have had a very close working relationship with during my training years, that they do have a very much structured alternative pathway already in place. And the physicians or anesthetists who are working there, They had no problem if they are not getting into the training scheme. They don't take it too hard. They don't get depressed, but they still have the options to progress their career through those. And that was a great motivation in my own journey. And I do believe that if you don't have a path to a goal or a destination, I think it's your responsibility to create one. When I graduated from my medical school, I was the first trainee to start the journey of emergency medicine training in Pakistan. And at that time, I had the same vision that if there is no pathway already designed, I will be the one who will carve that so that the juniors behind me can follow the path. And I'm very much grateful to the opportunities that I got during my training period. So coming now to basically, this was just an introduction that this is the whole idea of what you need to get registered in the specialist division of Irish Medical Council through the alternative pathway. The crux of it is, or the core message is, that you have to prove yourself equivalent to whatever an emergency medicine trainee can do. And you have to prove to the medical council that you have done all those courses, all your clinical experience, all the examinations, the qualifications, the publications, audits is equivalent or similar to what is expected from an emergency medicine trained physician. And once you are able to prove it to the medical council, then they grant you the specialist registration in emergency medicine. Having said that, it is not an easy task to prove your 10 to 12 years, 15 years of clinical experience. Personally, my own application was 1,276 pages. And out of that, my FRChem degree was just 1 page. So you can imagine the amount of work that goes into compiling all the paperwork and compiling your application and bringing all your evidence support in the support of your application. So generally, the training and the non-training pathways are the two main things. Okay, so I would like to describe a little bit of the benefits and disadvantages of both. Okay, because it is very key important. It is a very important, you can say, stage that we are making a big decision in our life, that whether we are interested to go for a training route or whether it is appropriate for us to go via the non-training route. As we mentioned, that training route is very much straightforward, okay, and it consists of 3 years of core specialty training, followed by 4 years of advanced specialty training in emergency medicine. And once you finish all the qualifications and the assessments during your training period, you are awarded a certificate of completion of training, after which your registration with the medical council automatically switches to the specialist register. Next slide, please, Ahmed. This is just a summary or overview of the same thing that has been shared previously by my other colleagues. So the training pathway has its benefits, and I want to emphasize all the new youngsters and young people who are early on in their career that this is the training pathway is something that I would highly recommend. First of all, anybody who can get into the training pathway, it is a good opportunity and is better than the alternative pathway. But if you are not successful in getting into the training pathway, don't lose hope. Alternative pathway is very much possible. It is very much viable. And I had, there were times when I was doubted by other people, you know, from my family, from my colleagues, from my mentors, whether this is possible or not. And even from myself sometimes, you know, but with consistency and resilience, you get to a point where you know that, you know, this is something very much doable. So the training pathway, why the training pathway I'm recommending is that, first of all, it is a very straightforward pathway. Once you get into the training scheme, your pathway is quite clear to you. and it is a very structured program. It is very well supported by the college, so you don't have to put a lot of personal effort into thinking about what you are going to do next and what you are going to do next, where you are going to apply next. So it takes a lot of mental burden off of your shoulders. And in comparison to the non-trainee posts, the SPRs are salary scale is higher. So during your training years, your salary is a bit higher than the non-training post, which is also a good incentive. The training pathway, or when you get your CCT at the end of your training, gives you global recognition. So let's say if you want to apply and work in Middle East after you become a specialist, having a certificate of completion of training always gives you an extra credit or merit. Now, it's not the only thing that counts, but it is something that is highly valued. So that is one thing that you should also consider in making this decision. In my personal journey and my personal experience, what I have found that because when you are working in a competitive environment where there are trainees along with yourself, a lot of projects and opportunities and courses, they are first distributed to the trainees, and then anything, in which you really show your interest, you get a share of it. So if you are already on a training scheme, it is the supervisor's responsibility to train you and to give you the project and make sure that you do it right. So you get a lot of support from and mentorship from your seniors. But if you are not in a training scheme, then you have to really put yourself out and make your face visible, that this is what I want to do, I'm capable of doing, and this is and it's a real struggle. Like, for example, just getting onto the ATLS course, after COVID especially, there was a long waiting time, and I probably applied for 3 or 4 consecutive years because my ATLS was expired. And every time I would apply, I was told that there is a queue of trainees and they will be given a priority. And once the trainees are all trained in the ATLS, only then I got my chance to renew my ATLS. So these little things, they do happen. They do slow down your career progression a little bit. And once you are in a training scheme, as I say, I had to produce 1,276 papers as a part of evidence in support of my application. But once you are selected in a training scheme, you don't have to produce that much evidence. Your CAPA session and your RITA assessment forms, they are good enough. You don't have to keep a log book of all your patients. But in my case, as I said, I had to make a log book. So from my 12-15 years of clinical experience, I had to provide them with the type of cases that I have seen and the type of procedures that I have done and the competency levels of those procedures that I performed. So everything had to be signed and stamped, from my supervisors and from my departments that I had worked in. So it was a lot of paperwork involved, and if you are in a training scheme, you can get rid of some of that. And as I say, it is a very much guided route. So you have a mentor whose whole responsibility is to train you. Okay, so there is a dedicated mentor or supervisor for you to train you, which is a very positive. It boosts, and it is a very good thing. Having said that, the training route has some downsides and challenges. So first of all, it is a very competitive route, especially entry into the training scheme is very competitive, as in the previous application presentation, as the colleague mentioned, there were 300 applicants and only 30 seats available for entry into the CSTEM. Likewise, imagine that the 30 people have completed the core specialty training and there are only 16 seats available. So what will happen to the rest of the 14? Obviously, they are not going to go into the advanced training. So have they just wasted their 3 or 4 years of CSTEM, or what are they going to pursue? So that is the cohort of emergency trainees who complete their CSTEM but are not able to get into the advanced training. I think that is one cohort that will really get benefit of the alternative route. As part of the training scheme itself, the process involves and requires you to move into more than 1 or 2 hospitals. So you have to move out of your comfort zone, your hometown, and particularly you have to have some experience in Dublin hospitals. So someone with a family or, with children, as I do, it was very difficult for me to keep changing schools of my children every 6 months. And I was, obviously I am a non-EU person, so I had to renew my visa stamps and whole of the family visa stamps and getting all the paperwork done for the whole family and getting them enrolled into the new schools. It was a big hassle for me. So anybody who is at that stage of life where they cannot move from one place to another place more frequently, training program is going to be very disruptive in achieving that work-life balance. And as you will see, and it probably was mentioned as well, that having a stamp or visa for non-EU and non-Irish people is a requirement for entry into the training route. So this is going to delay your career progression. So if you are here already 2 or 3 years working in emergency medicine, and then you apply for the CSTEM and then get entry into, after having a stamp 4, you apply for the training scheme, then it is again, a 4 years of ASTEM. So it becomes a lengthy process. So visa requirements sometimes can hold you back getting into the training scheme. And as I say, it is a time limited program. So if you are unable to, let's say, finish your FRChem exam for whatever reason, for being unfortunate on the exam day, and you have finished your training, 4 years of ASTEM training, but you unfortunately did not pass your OSCE exam before the end of those 4 years, what you are going to face then at the end, you will not get your CCT. What will happen that you will then have to apply through the alternative pathway, and the whole application pack that the alternative pathway doctors are supposed to submit, you have to submit as well. So there is a time limit. So you cannot take, for your personal reason, for your health reason, for your family reason, you cannot take time out. So there is only 1 year allowed to take time out of training, and it is also conditional, so if you need more than that, your training will be disrupted and you won't be given, you won't be awarded the CCT at the end. So that is something that people who have come from abroad, the international graduates who have families and who have been trained in Pakistan or in Sudan or in South Africa, and after completing 3, 4, 5, 6 years of training and work experience there, and they have the kids and family, when they come here and starting the new journey from stage zero is very difficult. And as I say, it is less flexible. There is less flexibility in a training program as compared to if you are trying to do the alternative route. It is a bit more flexible. So next slide, please, Ahmed. Thank you. So the same thing that, as I say, the CSTEMs, there are 30 posts, only 15 go, or 15 or 16 go to the ASTEM level. So the rest of it, obviously, if they want to pursue the career, they have to obtain it through the alternative pathway. Next, please. The same thing that the STEM 4 is a requirement. We were very fortunate in 2021 when this legislative change was brought into action. Before that, the non-EU or international medical graduates were not even able to get into the schemes at all. So it was almost impossible. And in 2021, when this legislative change happened, it opened up doors for Pakistani, Sudani, and South African doctors and other Nigerian doctors who can gain into the training scheme, which has been mentioned by one of the other previous presenters. Next slide, please. Now coming to understand that the benefits of going through the alternative pathway. As I say, it is very independent. So your training route or your clinical attachment or your job description is in your own hand. So whatever you want to do, if I think that I want to do 6 months of anesthetics first, or 6 months of, or 1 year of emergency medicine first, it is in my hand. Okay, so this gives you the freedom to decide about your career route or career job opportunities that you are going to apply for. The visa status compliance is also one thing. For example, let's say if you have landed here in Ireland in 2025 and you have worked here for 2 years before you get a stamp 4, these 2 years of experience doesn't get wasted. It doesn't go wasted. Otherwise, if you are applying for waiting for the stamp 4 and then applying for the training scheme, the the only advantage that you are getting from these 2 years of experience in Ireland is that a few points in your interview at the training scheme interview, but it's probably not going to give you any more credit into it. But let's say if you have 2 years of experience, then 2 years more, you are already done 4 years of emergency medicine with pediatric and anesthetic rotations. You are good to be a consultant after 4 years, okay, provided that you have some previous training background as well. And it is more flexible, as I say. If I want to take a break, if I am not feeling well, if I have some family commitment, I can take 6 months break. I can reshape my career. Obviously, it does not look good when you apply and you submit your application if there are big gaps in your working experience. So I wouldn't recommend it doing just out of fun, but sometimes because of the responsibilities other than work, what we have, sometimes we have to take these splittings and breaks and gaps in our career, which can be possible in this route. You can try not to move across the country so much. Let's say if you have selected the southeast region in Waterford, Wexford, or maybe southwest region, Cork, Kerry, Limrieck, you can rotate in these areas and then finish all your rotations and then apply instead of moving up and down the whole country many times. It can sometimes be shorter. Like, for example, in my case, when I came in 2019, I had previously completed my fellowships from my Pakistani college, and I had completed my 5 years of training program. But when I moved with my family to Ireland, COVID hit, and I did not have stamp for visa at that time. So I started working as a registrar in emergency medicine with this thing in my mind that I have to progress. And when I saw that during COVID time and because of the visa, I was not able to, I wouldn't be the priority, you can say, or I would be down in the list to get onto the ASTEM. And even if I go to the ASTEM, I still have to work on a registrar level for 4 years. And for sure, out of that, I have to spend a year and a half or 2 years in Dublin, and I have to move the family. So imagine it was 2019, end of 2019 and start of 2020 when I came. So in that sense, you are talking about, I would still be a registrar, but I went through the alternative pathway, and alhamdulillah, I completed all the paperwork and all my requirements within 4 years, and it's the 5th year now in Ireland now. So after that, I have achieved what I aimed for. Sometimes it can be shorter. The challenges are that it is uncertain. Obviously, there are a lot of questions that are raised about it. It is not impossible, but definitely you have to be really self-motivated. And that's what a lot of people lack at some time, because when they feel that they are getting not equal opportunity at some points, or maybe, they are tired of the questions, they feel depressed or they give up. So don't give up. Okay, it is sometimes lengthy, because if you have an experience in a non-training institute, 1 year of experience will be counted as 6 months of your experience in a training institute. So despite you working in a non-training institute for 1 year, only 6 months will be counted. Even if you have worked there for more than 3 years or 4 years, the maximum experience that you will be counted for is just 1 year. So if you spend a lot of time in easygoing, I would say, or non-training departments, it wouldn't give you much credit. Okay, so you have to work very competitively in a competitive department which is approved for the training post, and that point, the it is approved for the training post, and then it gives you credit. But if it is a non-training department, then your experience will be counted less, so the overall journey can become sometimes lengthy. As I previously mentioned, that the salary for a non-trainee registrar post is lesser than the SPR scale, so this is one thing that you should also consider. Whenever globally, when you go out to Middle East or other, Australia or Canada or any other country, anybody who has a certificate of completion of training is ranked a bit higher than people who have not completed training. But if you have more experience as working as a consultant, then these things can be managed, or you can say can be counter for. The other challenge that a lot of non-trainee registrars face is that whenever there is a project or an audit or a research work going on, first, the trainees, because the whole program is designed to train them, they get an opportunity to do a lot of research work and audit work. But if you are not very proactive, it is highly likely that you might feel left out. And very big projects, maybe, in the departments going on, you might just be not a part of it. I would recommend that even if you feel that you are not the main lead of that project, still attach yourself to this project, as a co-author or a co-lead. And as Dr. Ashraf mentioned, that you can create some work for your own self, that can benefit the department, and come up with the ideas that I want to do this project, and take a lead. And as I mentioned, you have to be very meticulously record keeping whatever you do. You have put a cannula, you should take out a DOPS form, directly observed procedures form, get your supervisor or consultant who is on the floor to sign it for you. You have put a chest drain, get it signed. You have put an intubation, get it signed. So if you have patient record, all the patients, there are softwares that you can get help from, like ELOS, or like the National Employment Record, the NER website. The RCSI has the e-portal for the CPD activities. The RChem has its own, where RChem members can use their account to log their cases. And even the HAC Citrix storefront, in the ICM, I had collected all my patients' records, electronically. I don't even have to bring home any data, patient data. It is stored in the hospital HAC system. So any patient I see, I make my own list. So you can keep a record of your patients that you have seen, and IPMS you can take out the data from IPMS, all the patients that you have seen, and make a logbook of that. And one of the big challenge that people face in this route is the lack of guidance. And at this point, I really want to share this and invite all the colleagues who think that they need guidance following an alternative pathway. I'm more than happy to guide you, and you can take my contact details from Dr. Ahmed and contact me, and I will be more than happy to give you insight about it and provide you with the documents. Now, going forward then, once you think that you cannot, or you are not able to, or the training pathway doesn't fit you, you have to apply via the alternative pathway. What you are going to do then? Okay, so let's move to that. Next slide, please.
We just this thing is freeze up. A second. It moved, yeah?
Yes. So the main goal is you have to show that whatever an emergency medicine trainee can do or has done, I have done the same, basically. Okay. That's basically whatever the rotations, whatever the ASTEM rotations, publications, audit requirements are, the CSTEM requirements are, the courses, the human factor courses, the mandatory life support courses, you have to do the same. Next slide, please. There are 4 areas of application. Now, the process of getting an application from Medical Council has been streamlined. When sharing my personal experience, when I came in 2019, just before COVID hit, I had applied and emailed the Medical Council. It took them over a year, 1.5 years to give me the application pack. Since then, I have freely distributed the application pack to a lot of my colleagues. Some of them actually became consultant before I did. And but after in the last 1.5, 2 years, what I have noticed is that they have streamlined. So if you go onto the Irish Medical Council account and log in through your own account, and send a request email that I want a change of register from general register to a specialist register in this speciality, they will send you within a few days. They will send you the exact application pack, and this is the first and the foremost step, because anything that I say, it might change. The medical council might update their guidelines and requirements that I may not be aware of at this moment. And the exact point that you have to be sure about, what the medical council is looking for, is the best sources to ask them what you need me to submit, what are your requirements to register me as a specialist, and they will tell you that this is the application pack. And it is a very specific pack. You cannot put any staples in it. The audit report forms, as it has been mentioned, you have to put the audits, but it has to be written on the audit report forms that are in that application pack. The hospital audit report forms are not acceptable. So you have to literally replicate all your audit work, all your publications work, all your experience, even your CV. You have to submit it on that template that the medical council has provided to you. You cannot just submit your own personal CV that you have it for your personal use. So you have to replicate all that work onto the application pack. There are 4 main sections. The first one is about the qualifications. The second one is about the training and equivalence. The third one is experience, and the fourth one is the professional attributes. Next slide, please. So in qualifications, okay, so the 2 other important things that are available in the application pack itself is a list of presentations and procedures that must be mastered. This is the website that you can get this is the link where you can get the procedures and presentations that should be mastered. And next slide, please. And the common competencies for emergency medicine. So you have to get these lists and match your competencies. All these competencies that are asked in the RChem curriculum document, you have to provide documentation for that. Okay. The qualifications that are acceptable for specialist registration are first or foremost is Fellowship of the Royal College of Emergency Medicine UK. And if you don't have this, then the Fellowship of Australian College of Emergency Medicine is directly equivalent. So either of that will work. Other qualifications may include the fellowships of Hong Kong, Canada, United States, and South African postgraduate training bodies, but they are not exactly equivalent. So if you have got trained in those countries, you still have to do some extra training and extra experience here, and the qualification will be then. And you have to prove that your college curriculum was similar to what the RChem curriculum is, and that your assessment method was very much similar or equivalent to what the RChem method is. So you have to get a copy of the curriculum from your college. You have to get a copy of the examination system of the college and submit it with your application pack. Then talking about the training and equivalence. Broadly, you have to show that it is comparable to that provided in the RCSI program, and it means that the following areas will need to be satisfied. Mainly, the emergency medicine. Okay, duration is 7 years, and out of that, 4 years are required at minimum of registrar level or ASTEM equivalence. And the training in related specialities, for these should be documented training that you have pediatric emergency medicine, at least 6 months. But as you will know, that CSTEM has 6 months of pediatric emergency and ASTEM has 6 months of pediatric emergency. What I did was a year of pediatric emergency, but I know a few cases in which they have considered 6 months and maybe 9 months equivalent, depending upon case to case application they assess. Then you need to have at least 6 months of anesthetics and intensive care experience In my personal experience, I did a year in anesthetics, and I have special interest in critical care. So I did 1 extra year of fellowship in critical care medicine, intensive care medicine. So that was really helpful. Anybody who is looking for making a career in emergency medicine, I would highly recommend to spend at least 1 year in anesthetics and intensive care medicine. It really changes your practice, it really boosts your confidence, and it really uplifts your skills. And it is a very core skill set and very core training part that I would not recommend to cut short. There are no shortcuts. I wouldn't recommend you to take alternative pathway as a shortcut. It is very dedicated route. And anesthetics, I would say, don't make any shortcuts that, okay, I can just get signed off. No, I think the better it is a very core skill set that all emergency physicians should be really great at. So I think don't take any shortcuts in that. And now that is an interesting thing, that the other experience that they are looking for is either plastic surgery or orthopedics or acute medicine. So I did not personally have any dedicated orthopedic or plastic surgery work experience as like a job or a rotation. What I had was that in my initial years, when I started my career, I started my training as an internal medicine trainee in Pakistan. So I provided that as an acute medicine trainee pathway experience. But I know of people who have not done acute medicine, but they have done plastic surgery instead. You still have to prove your competency. So let's say if I did not provide them as a 6 months of rotation in plastic surgery, but I had submitted my DOPS forms and the competency forms, that I have seen these cases of plastic surgery related, wound management and burns and all these cases. So you still have to prove your competency. Then it is very important to know which are the training sites, because the experience in the training site is considered equal to the training post. But if you have gained your experience outside these training sites, your experience will be considered on 2:1 basis. It means that 2 years will be counted as 1 year. Okay, so this list is available on the RCSI website. You can get a list of these training sites in Ireland. Next slide, please. Now, the third part of the application pack is providing experience. And as I mentioned, that you have to provide logbook of all the patient and the cases that you have seen. I was very lucky. As I said, I have actually completed a formal training program back home. And as a part of that, I was supposed to maintain my logbook. So I had my logbook for my training in Pakistan. Then when I came here, I kept a record of all my patients seen in the ICM and the IPMS system, and my own, ELOS and NER portals. And in addition to that, when I went to anesthetics, I got enrolled into their, I made online account of their JFICME and College of Anesthesia. I got membership of those, and they have logbook options as well. So every day I would log into my cases in that, and I got signed off from my supervisors over there. You have to show them that you have undergone serial assessments and appraisals. As I say, here is the role of a mentor in your department and your consultant. If you have a mentor and there is a culture of 6 monthly or 3 monthly appraisals or assessment, it is very important. So there are in training assessments or ITA forms which are available. You can find it online, or you can just make up a form, look at the forms that your fellow trainees are using and just use it, and get your supervisor to sit with them once in 6 months and sit with them and get those forms signed, because you need to provide that evidence. As a part of medical council requirement, your rota should involve the night shift, bank holidays, weekend work, and the shift work. So you cannot just take up a post, let's say in a medicine outpatient department, as an AMAU registrar or SHO, and count it equivalent to the EM trainee experience. So you have to provide the evidence that your roster that you have worked in is equivalent to what an EM trainee does. Then there are some mandatory courses, audit and research details I will discuss in the next slide. These are the mandatory courses, okay, at advanced trauma life support, advanced cardiac life support, advanced pediatric life support. So these are basically the life support courses. Then there are major incident courses, MIMS and HIMS, and ultrasound level 1 and level 2 courses, and you have to sign off. It is mandatory that you have to get signed off. There is one day that happens in December that Royal College of Surgeons in Ireland have dedicated to sign off. Once a year they have dedicated for non-trainee people. Other days are for the trainees. So you have to really be prepared before they announce that date, because if you miss that this year in December, let's say, you have to wait for another year, or you have to go to the UK to other Bromley courses or any other ultrasound training institutes where you can get signed off. And human factors and patient safety courses are also required. Then the research requirements are that you should be first author of 2 peer-reviewed publications, and you should provide evidence that you can critically appraise journals. When I started, I had a critical appraisal paper for the FRChem, but it has now gone. There are only SBA and OSCE now, but still, you can provide your experience that you are a part of journal club activity in your department. And in addition to that, you have to submit the evidence that you are author of 2 presentations at national meetings. The fourth part of the application consists of professional attributes. So the areas that you need to demonstrate are relating to patients. So there are forms where you can get survey from your patients, feedback from your patients. Then communications and interpersonal skills. A lot of the things that can count for evidence here, if you have done communication skills workshop, breaking bad news and all these human factors workshops. The collaboration and teamwork, how you can show that if you have done a multidisciplinary quality improvement project, you can also there are feedback forms from the colleagues as well. You can get from your surgical colleagues, from your senior, juniors, nursing staff, other departments that you closely work with. You can get some feedback forms from them. I would highly emphasize on the part of management and leadership, okay, including the self-management, that you are able to manage your, you are on time, you are punctual, you are taking keen interest in your personal growth and in the department's activities. It is very important that you take up lead, as Dr. Ashraf mentioned, you take up lead in one of the leadership roles and become a lead in activities. Things that you can go after is managing rota and managing journal club activity, managing teaching for the NCHDs or medical students, or managing clinical risk meetings. So these are all the activities that you can look into. Again, professionalism and your own clinical skills and the teaching. In terms of teaching, you can how you can provide evidence. The adjunct lecturer posts are available at different universities, especially attached with the teaching hospitals are attached with. You can search for these teaching experience certificates in your local hospital if you can get one, or you can speak to your supervisor or your consultant that if you can get a letter stating that you have been a part of teaching activity involving the undergraduate and postgraduate or NCHD teaching activities. Then at the end, you have to submit 5 referrals in total. All must be the specialists. And the first reference should be your clinical director or supervisor. At least 4 of these references should be consultants in emergency medicine. And they must be in a position to say that they have supervised you directly. So it should not be that, oh, I know this person. But it should be that, yes, the people who have closely supervised your work during your NCHD years have to give you their references. So here comes the networking part. I would highly recommend that if you are thinking to go for alternative pathway, select a department who has good representation of emergency consultants in professional bodies, because they have a lot of impact, and if you have references, good references from them, it can make your application really sound really successful and outstanding, so that it's very less likely that they will make any objections.
Thank you, Ani. Thank you, Dr. Aniqa. That was very,
Thank you
very,
very
very
much.
comprehensive
And
and
one last
informative.
comment that I want to mention going forward. I would tell that doing emergency medicine alone will not be enough. As I can tell you, it is very competitive, and it's getting competitive. Even if you get into a specialist register and register as a specialist, getting a consultant job is going to be very competitive. I would highly recommend even the trainees to develop their special interest. Like, for example, the pediatric, there is a good swing coming on about pediatric emergency medicine. So we are expecting to see a lot of job opportunities for PEM consultants posts in big centers, and the trauma consultants and critical care MICA consultants and geriatric emergency medicine. So it is very important that you identify any of these additional areas in which you think that you are strong or you have special interest, and this will instantly differentiate you and stand you out from other colleagues. Okay, thank you.
Yes, that's very, very valid point, actually. Yeah, everything is competitive now. Thank you so much, Aniqa, for that. Dr.
Thank you
Ashraf,
very much.
I definitely have some comments for us.
I do, yeah. Thank you very much, Dr. Aniqa. This is, I don't envy you the task. It's a mammoth task to try and present on the alternative pathway. It's, I think, just how much you've told us, how much you've spoken about it tells everybody, how big an achievement it is once you get it done. Because it takes so much work to try and build up the evidence. The point that I would try and make is that you need to start compiling evidence as you go along, going back to try and collect evidence for work that you've already done is very difficult. Again, nothing is impossible, but it will make it so much harder to do that. The medical council is very fair in their assessments. They have a very structured way of correcting applications, and they generally are very approachable with questions and things like that if there's anything that you'd like to know. In terms of the PAC, I recently have a colleague that has applied, and like Dr. Aniqa said, they have actually streamlined the process. I think now it's almost like an online application, and the moment you submit it on the website, you get an automated email with the PAC. So the PAC will actually have, contain most of the things that you will need. I suppose I might just comment on a few things. I think in terms of the qualifications, the FRChem, what I would say about that is, it's actually one of the, compared to our other colleagues from other medical specialties, it's become a lot smaller. And compared to when we took the exam, again, it's become a lot more compact. Material for studying, Arkham learning. I can't stress how important it is as a resource for the exam. These are the people that write the exam. Most of the material for the exam is actually on the Arkham Learning website. It's a really good investment to become, to have an Arkham membership and access to the Arkham Learning. There are some courses, probably courses, and a few other people that do the courses for the exams. Again, very important to have a mentor. I can't stress enough how it is helpful to have somebody who can guide you and remind you. exam date is coming, register. Just even having that sort of support, somebody who's senior, who believes in you, and pushes you is, we all had it. Someone who's advocating on your behalf and pushing you to become better. And then study buddies for exams. Again, very, very important. I would highly recommend having someone peer your level who you're studying for exams with. In terms of the second point that Dr. Aniqa has mentioned, the training equivalence, again, it's a very big topic to speak about, but quick pearls that I would talk about is, I suppose, what I would say is pediatric emergency medicine. I have some experience. People have gotten away with working in mixed departments that cater for both adults and peds who haven't done dedicated PEM, because those jobs might be a little bit difficult to come by. But again, they're out there, and if you apply and keep applying and showing interest, you'll get a PEM post. If you find difficulty with that, there are some departments, particularly training sites, that are mixed adult and peds, but they have to do pediatric emergency medicine. They can't be departments that deal with surgical peds. They have to actually be departments that see pediatric medical issues. Anesthesia and ICU, 6 months rotation is the minimum requirement. I know of some colleagues who got away with 3 months rotation with a very strong and robust procedural DOPS in anesthesia and ICU, and resus logbooks. These are important. Some sites now provide an ICU anesthetic rotation as part of the contract, so you can get a 2-year contract with a 6 months ICU anesthetic rotation. Particularly in big hospitals, they have an interest in providing that, and they know that this sort of a thing would attract a better caliber of doctor. So they're starting to introduce that. Acute medicine, again, acute medicine, orthopedics, plastics. Like Dr. Aniqa said, people have gotten away with with none of the three, but I would advise that you take up either an ortho or acute medicine. I would suggest, though, that you present evidence that if you've done a 6 months in orthopedics, then make sure that you're presenting evidence for acute medicine in your career, in your practice in the emergency department. Again, if you've done acute medicine, make sure that you're highlighting your orthopedic exposure in your emergency medicine practice. In terms of the third point, which is the experience, logbooks for, just briefly, pediatric emergency medicine, for anesthesia, for ICU. It's helpful to have a resus logbook. In terms of how many cases should really be on your logbook, like, it's a huge thing to present a logbook for all your cases for all your years of experience. So generally, what I would suggest is 50 cases per year, with reflections on 10 cases. That would be what I would suggest. 50 per, but it needs to show that you're working across the breadth of the curriculum. So, it includes injuries, trauma, acute medicine. It just needs to, sort of cover the breadth of the ARChem curriculum, the SLOs, structured learning objectives. Reflections, like I said, and DOPS for procedures. What I found very helpful with some of the trainees, non-trainees that I've worked with, is Kaizen. Kaizen is, the Kaizen portfolio is very, very useful. It's an ARChem based logbook and portfolio builder. It's a bit fiddly at first, but once you get used to it, it really just shows you what you need to get done on a day-to-day basis. Assessments and appraisals, I would suggest filling out the CSTEM and ASTEM forms in the pack at every post. 360 reviews, like Dr. Aniqa said, letters from 360 reviews. Again, the Kaizen portfolio in RChem automates this. So, you just fill out your own self-review and then you send out, you put in the emails of the people you want this sent out to, and it just gets sent out and they reply by filling out the form. So it sends out forms to everyone. They fill this out and they send it, you get a report back once it's done. Mandatory courses, there's difficulties around that. ATLS, APLS are a little hard to come by. There's 1 or 2 courses a year. I would suggest, an European trauma course. I know of colleagues that have, that's been used as an alternative to ATLS, and EPALS as an alternative to the APLS. POCUS is centralized sign-off, like Dr. Aniqa said. Make sure to be ready when December comes. MIMS or HMIMS, usually provided in the UK by the ALSG group, providers of ATLS over there in Manchester. And hopefully soon to be provided here in Ireland by some private providers. Management, professional attributes, management leadership roles, very, 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 very important. Like Dr. Aniqa has said, it's the very fact that you have a leadership role and you're presenting evidence for that, you're already automatically presenting evidence about communication skills, about collaboration and teamwork, about professionalism. Everything is you can use your management experience, leadership roles to present that. Teaching, again, very important. You have to provide evidence of that. In addition to Dr. Aniqa's suggestion of tutor roles and that sort of a thing, life support instructor courses, okay, are a really good way of proving that you have robust training, leadership, teaching capability. So, ACLS instructor courses, I know that they've changed recently the way of selecting. So it used to be you had to be IP'd, as instructor potential for ACLS. Now, anybody that has completed the ACLS course can walk up to the ACLS course director on the day and say, I have an interest in becoming an instructor. And if you've performed well, they might consider you. Other than that, train the trainer courses. Again, very, very useful way of proving your competency as a teacher. Other than that, finally, I'm just going to speak briefly about, I know it's been a long day, about your references. Again, your last couple of years of experience, when you're almost ready to submit your application, are crucial. You really have to select where you're going to be in the last year or two of your junior and your senior NCHD posts. Some departments are a lot more supportive than others when it comes to supporting applications for alternative pathway. It is always very helpful to attach to work in a department where there is 1 or 2 consultants who have done the alternative route. They are going to have a vested interest in supporting you and advancing your career. So that would be something that I would highly suggest. Dr. Aniqa and Kerry, I'm sure would be a great asset. So if you're looking for posts for your as senior people, I would suggest attaching yourself to hospitals where people have shown that there's proof of concept, so to speak. Having said all of that, I'd like to thank you all, for everything that you've presented and for allowing me, giving me my some small space to comment. Not that I would know much more than all the ones that have presented. Everybody has been so brilliant, and you've left me so little to say. Back to you, Dr. Humaida, and thank you so much.
Okay, thank you, Dr. Ashraf. So I think that's bringing us now to the end of our formal presentations. What an incredible and informative journey last 2 hours. We covered like different things through CSTEM to ASTEM, side entry, and alternative pathway. I would like to take the chance to huge thanks to you, to all our speakers, Dr. Alaa, Dr. Ammar, Dr. Farhan. I think he left because he's now in vacation. Thank you for him for giving us some of his valuable time after both nights. And definitely Dr. Aniqa as well for sharing all of you, for sharing your invaluable experience and expertise. Now do you have any questions? I think I posted already in the group chat. If we have few questions, the time is late, but we can take, I think. Are you happy to take some questions? Yeah. So, think that there is no many questions, but the first question, will there be a graduation year limitation like what was or must happen last intake? Yeah, I think that's difficult one. Anyone have idea? Ala? Or maybe the boss,
No,
Ashraf?
I haven't heard anything about this year. Nothing yet.
Okay, I think that's, nothing was mentioned about that. There's a question for alternative pathway while I'm waiting like anesthesia or ICU rotation. Are they training both or not? And how can we apply for them? Aniqa, if you
So
can
you
take
can
that
apply
question.
for the non-trainee post, as I did. My post was non-trainee, but it was in a training department.
Yeah.
I would recommend you, if you have not done anesthetics before, to go for an SHO post. But if you had done previously done as an SHO, 3 or 4 months, or you have some exposure, I had a good experience in anesthetics, so I applied for the registrar post and fellowship post for ICU.
Thank you so much, Dr. Aniqa. Dr. Ammar Ahmed, you are raising your hand here. Go ahead.
Yes, I just wanted to add for our colleagues who usually are planning to apply for the side entry, and they have their emergency medicine experience, but they don't have a pediatrics or anesthetic experience. It will be advisable that if you are planning to have those rotations done, to have emergency medicine in between. By that I mean finish emergency medicine experience, do peds, go back to emergency medicine for 6 months, go again to anesthetics for 6 months. Because if you stay off emergency medicine for a year or two, you will not be shortlisted, and that's gonna be used an excuse for you against you, because they will say that you're not practicing emergency medicine for the last 2 years. So just be slightly smart when you decide to apply for those rotations to be eligible for the side entry.
They might discuss that you might escape emergency medicine and lead to
exactly.
a comfortable job in anesthetics.
Yeah.
There's one question here. This is a very common question actually for many different specialties. This question, can we work as a consultant in the UK, Europe, or Gulf countries if we got specialist registration to the alternative pathway? Ashraf.
Yes, the short answer is yes. The short
Yes.
answer is yes. In all three jurisdictions, you can definitely work as a consultant in the Gulf or in UK or in Europe. So in Europe, obviously, Europe and UK are actually very easy because your specialist registration is automatically transferred to all the medical councils in these countries. I'm not sure about non-English speaking European countries, but the UK, it's definitely your specialist registration is transferable. but the UK specialist registration is actually not transferable to the Irish, just so you know.
That's very, very important information, actually.
That's actually not, that's a recent development that the UK specialist registration is not transferred. And so unless it's a CCST, if it's a CCST in UK, yes, it's transferable. If it's a Caesar registration, it's not automatically transferable to Ireland. You have to reapply again through the alternative pathway here.
Is that something due to the Brexit or like
just due to Brexit? Yes, I think. Yes. But in the Gulf and in particular, like Dr. Aniqa said in her presentation, she's absolutely right. The CCST holds a lot more sway, in the Gulf GCC countries, but the specialist registration with experience, particularly with lead roles as a consultant or with subspecialty, okay, you'll get good chances in the Gulf as well.
Thank you. Maybe the last question for today's sessions. Is emergency medicine experience outside Ireland counted? Aniqa, are you happy to answer that question? You can unmute yourself, Aniqa. Yeah.
Sorry. Yes. So it depends where you have gained the experience and what type of departments you have worked in. So it is case to case and post to post assessment. If it was a private clinic or a private hospital and it wasn't a training institute, it would not be counted for. But if it was gained in a training scheme or maybe even a non-training post, but in a training institute, you will get some credit. But as I say, you have to prove that the department was equivalent and, the practices and the guidelines were similar to what they are practiced here in Ireland. You might get a little bit of it if it is very, very different. But if you had equivalent department accredited for training, recognized by the Royal College of Emergency Medicine, then it is counted.
Thank you so much. Yeah, since that's the end of the second. So I would say on behalf of the Sudanese Doctor of Ireland, I would like to extend my deepest gratitude to all of you for your invaluable time and also to come here and share your experience. Thank you so much, and I wish you a wonderful night.
Thank you.
Thank you very much.
Thank you very much. Thank you.
And just one last thing that I forgot. There's a survey. I posted in the chat group. There's a survey. I think Aniqa, you can tell us more about it.
I am planning to arrange a workshop for people who are interested to know more about alternative pathway and what is the best way we can support people. What are they looking for? The things that I have in my mind, that the tools, the different types of forms that I needed. It was very difficult sometimes to get those forms. Then there is a timeline, as what things we should be doing in the first year, what should we do, how should we planning for our next 2 years, and then the last 2 years. So these type of things, I wanted this survey is basically to know what people, what is the thing that will benefit most of the people, so I can plan and make a workshop for it.
Well, that's great. I think that might be helpful for.
If I can just add to Dr. Aniqa, and I would ask her from here to, there's a group of consultants, international consultants who, a lot of them have achieved the registrations with the alternative pathway, who are all coming together to try and form one single body that would be aimed at helping everyone. So, it would be great, if we can work together and work with all our other colleagues. Even we need our trainee colleagues to give us a prop and a hand as well. A lot of them are trainers themselves. Thank you.
Sure, I would be very delighted to work with you.
Well, thank you so much. Also, I think Aniqa definitely can join you now. Fresh, a good consultant. So, thank you. Have a wonderful night.
Thank you, everyone.